Of Alabama, how you all doing today? It's so good to see you today. We got some good stuff as usual to share with you, and we're going to try to dart through it. We got a few things, a few concepts I've been kind of using here and there. And again, what we talk about here is some of the things that we discuss in supervision. So those who have gone or supervisors or just wanting to learn can use this in practice or with their supervisees. And so, what I want to talk about today is oh man, we've had so many wins today. But what I want to talk about today is how you would kind of navigate and work with a client who might be showing some anxiety. You kind of feel that they have somewhat of a critical view of themselves. It doesn't have to be anything like chronically bad, but they have some things going on to where it's like, I don't know. I don't think that they have a real good positive view about themselves, at least on the level that to where they wouldn't experience as much anxiety as they do. And so you're working with them and you're trying to identify what the concern is. Let's just say that they're having panic attacks. So the client's having panic attacks. They have trouble sleeping. They're type A, okay? And they're having these concerns, and you notice some things that may possibly be contributing to these symptoms, and you're thinking that, you know what? They seem pretty confident, but I don't really know. I think that they have some issues with the way that they look at themselves, but I want to get down into it. And so we start going down into what we call free association. So some of you all, like when you are in supervision, at this point, you might introduce the case to your supervisees and then kind of ask them or have a test question, a multiple choice test question that asks the supervisees what free association is. And then you can even engage with like, what would that look like in a real scenario, real situation? So these are some of the things that we talk about. So we want to know how we use that with this client. But before we get deep into that, I do want to segue over for a moment and take a look at this because we've got some things coming up and we want to let you know about it. We have a DSM-5 TR training for those of you all who are LICSWs. We're going to go through this real quick. LICSWs, we've got a training for you. This is now required for LICSWs. Not my training, but a DSM-5 training is required before you get your renewal. Okay, that's been put in effect. And so then we also have a self-paced one, and we've got a steal on this one, self-paced. And so you can go in and still get some great information, just as good as the live on the self-paced. But look, we have a training especially for you and everybody from Social Workers Alabama. You know, you get a sweet deal on this. And oh, I'm so excited that we have Alicia Thomas. She's going to be speaking to us on PTSD and today's military. She's another one of my former supervisees that's killing it. I've talked about Candace this week, talked about Madeline. All of these ladies are out there really making it happen and so proud of them. But yeah, she's going to be speaking about that. So we want you to tune in to catch that. And then lastly, we have our training, our supervisor training that occurs again in May. If you all need to watch, if you're on Social Workers Alabama, you need to watch the testimonial of Candace, and this will give you reason to want to go on and handle business and become a clinical social worker because there's a lot of opportunities there to bless people and to get a nice financial reward. They're really killing it. All right, anyway, let's go on and get into the matter. So we have our client here, and I'm going to share my screen again, y'all. This is a good one. This is one you might want to use. You might want to use if you got a client. Like some of these old school tactics really work. And I'm trying to get to the point to where I understand how to do a lot of them. And that comes with getting the appropriate training that we need, right? Okay, and so here we go. Free association. So you want to define that, and I just got this off of study.com. The practice of allowing the patient to discuss thoughts, dreams, memories, or words, regardless of coherency. Okay, we're not looking for a lot of coherency a lot of time because if it's real coherent, then I'm probably not getting the information that I really want. With Freud, he created this, and we're trying to pull from the unconscious. So a lot of people that have anxiety and we can't identify what that anxiety is, a lot of them that have repressed traumas and things like that, that they kind of have dug down, put deep into their bodies. Sometimes we can use these techniques because they don't have time to correct or cover, and it's a discovery form. The patient is allowed to talk without pause in a stream of words. So let's just say we have our client here. And so one intervention that I might do as far as free association with this client, that I'm kind of sensing that, like, in order for us to get near the breakthrough, it's going to be important that they are educated on how they really think about themselves. But sometimes I can do that through some talk therapy techniques, or sometimes it's good for the client to use their own words and express it themselves. There's little techniques that we can use to get that information, and that's what we do with free association, right? And so, and this may not be raw free association, but this is my demonstration of use of free association. So in this situation, what would you do if you were going to use this technique? What you would do is sit the client down and maybe say something like, because you think that they don't think good of themselves. Now, you didn't tell them that, and you don't want to give them any hints. You don't want them to know anything about where this is going. But so you're not saying, tell me what's good about you. That's a dead giveaway. All right. I mean, you want to ask them what's good about you, but you don't want to build it up. And what's good about you, asking them that, it could be somewhat of a giveaway, but you do it so fast they don't have time to really process it. So it's like you just say, boom, all right, in 30 seconds, I say probably use at least 40 seconds or whatever. You don't want them to get to where they're pausing and thinking. And every clinician, I mean every client is not always going to be honest and genuine with this because they're afraid of what's going to come out. You just got to go to a plan B intervention. But if they really are interested in the change, then they're going to say what comes to the top of their mind without trying to course correct it and just let it come out free. And that's when you really get to the heart of what's going on, and it'll help you with your assessment. So in this case, with, let's just say, with Bill, we're asking Bill, we said, Bill, look, what I want you to do in just this 40-second period, I want you to tell me what's good about you. So then we say, go. And we set the timer and we're going. And Bill's saying, I'm a nice person. I'm a husband. I'm a father. I'm a lawyer. I'm a good friend. Uh, a provider. Okay, boom, cut. All right, we're pausing a lot. Let's go on and get that, and let's try to assess it. So at that point, and this is what you want your supervisees to know, that you really kind of have to process this stuff on the spot, but you can do whatever you want to because you're the therapist. Now, if you don't really know the answers and you don't feel comfortable with that, you might just take it and say, thanks for giving me that information. We'll probably use this in some type of way as we go. But you don't tell them like, I don't know what the heck this interprets, because some of y'all might be nervous about interpreting it. As you go over time, you'll be able to make a quick assessment, and maybe we can do this here. So when we look at what was being stated here, we see nice person, husband, father, lawyer, friend, provider. What's kind of problematic here, and kind of suggesting that maybe we may be on the right track with thinking this person's view of themselves could be improved. Because it looks like this person, with their naming, is a lot of things that's relevant to what they do versus who they are, right? I'm saying what's good about you has a lot to do with who you are as a person. And when you respond based on what your occupation is, or what else is this describing? This is describing the person's roles and accomplishments. That's shallow and superficial. And many times this will come out, and you got to ask yourself the question, ask your supervisees the question, why do these things often come out this way? In other words, why is it that my client is responding on superficials? Okay. So if you using more of a regressive therapy, I would want to know more about the attachment that this client has experienced, more about what the ideas and values of their parents were. A lot of times I would look and say, hey, man, I need to know more about this because it looks like maybe what they have been groomed to believe is that what I bring to the table, as far as what I can do, as far as how I can show up in the world, as far as what I can do to be successful, that's more important than who I am. As a matter of fact, that person might be enmeshed with the roles and accomplishments that they perform and unable to separate who they are. So the thing is, and I've seen this happen a lot, right? So when you have someone that's like this, I've seen it in the most terrible way. It wasn't with a client, but someone that me and my wife knew very well personally, that they were making advances and were doing well in their occupation, but they probably would have answered this way about what's good about them. You see what I'm saying? This also shows where a person's values are. Okay, so this shows where their values are, and unless they're a narc themselves, a narcissist themselves, a lot of times narcissists will use these things against the person because they're really anxiously wanting to make sure that they're performing in this area. And that's like golden for a narcissist when they see that, oh man, you really want this. So what I'll do is beat you down, or use really smooth finesse type of techniques to make you think otherwise or question yourself. Yeah, you really seem to do that, or you really do well considering that you are the son of such and such, it was one. Anyway, I don't want to get into the examples, but that's what they'll do. They'll use it against you and leverage it. Okay, we don't want to get into the narcissist thing too much right now. But so in the worst way I've seen happen in a really bad situation, that guess what? When that accomplishment, the role, the job was stripped from this person, then they had no me, because their identity had been enmeshed in that. As a matter of fact, they were very boastful about where they were with that. So someone who's very prided, very boastful, very arrogant, and they identify with the superficials in this manner, when it's stripped away, it could be a real big ego hit. And some people don't handle it well. In this case, the person committed suicide or died by suicide, right? Okay. So that's what happened. So in it with this client, we're seeing there's some things, right? And it's sizing up with our assessment, because so much of what you tell me has nothing to do with who you are. It's what you've done and what you've accomplished, and maybe what your parents would have thought was good. But what do you think is good beneath this? Anyway, let's continue. So, I think we hit on a lot of this already. Um, so what would be a more balanced approach? I mean, a more balanced response to who I am, or the question of what's good about you. A more balanced thing would be talking about more about who I am, characteristics like I'm a kind person, I'm empathetic, you know what I'm saying? I'm patient, okay? Um, you know, the kind one is a big one, because what I've noticed with a lot of my clients, it's been deemed that somebody made them feel that, if, especially when I'm dealing with my codependency group, right? Somebody made them feel that if you stand up for yourself, or if you have boundaries and things like that, that you're mean. So much is focused on performance versus who I am. So I may respond this way, and a lot of times this is a clue, not always the case. This may be a clue many times about what I really think about myself and who I am, that I really don't have that much of a positive view about what I have to bring to the table, organically. Okay. I might feel like, I don't want to get too deep into that because we already at time, but that y'all get the picture. So kind empathetic, resilient, thoughtful, dependable, loving. These are some examples of things that show that you're more in tune and understanding of yourself and versus what you can do in life to receive achievement or accolades or to just be taking care of responsibility as that being number one. And so these are the people many times that aren't very well connected with their feelings and real vulnerable with their feelings as well, because you have identified more with superficial things versus the things that are really of value outside of that. And so when it comes to you understanding who you are, a lot of times we have problems there. So that's why I'm saying who you are, if you know who you are, then you also know what's good about you, and you can express that in a different way. Anyway, we're going to stop right here. We have gone on enough, and probably a little sooner. Yeah, I'm going to cut it right now to next week. But yeah, we will see you all again next week. I hope this has been helpful, and I hope you've been able to learn a little bit about free association. Y'all take care. We'll see you next week. All right. Bye-bye.